You drink plenty of water, you avoid salty foods, you've tried everything, but the dryness just won't go away. It's maddening. But what if the cause isn't what you're doing, but something you're taking every single day? Over 500 common medications list dry mouth as a side effect. In this video, we will uncover the biggest hidden cause of chronic dry mouth and, most importantly, give you a practical plan to manage it without compromising your health. You need to see this. We are talking about chronic dry mouth, or what health professionals call xerostomia. It's more than just an annoyance. It impacts your speech, your nutrition, and critically, your dental health. When saliva disappears, the natural protective shield for your teeth is gone. This leads to rampant tooth decay, which is a major health concern as we age. For those of us over 55 especially, the chance of experiencing chronic dryness skyrockets. Why? Because we are far more likely to be taking multiple medications. The bad news is many popular, necessary medications are the culprit. The good news is that understanding why they do this gives us the power to fight back effectively. Your medications don't actively soak up the moisture in your mouth. Instead, they interfere with the subtle nerve signals that tell your salivary glands to produce spit. It's like turning off the water faucet at the source. If the signal is blocked, the glands won't work, no matter how much water you drink. Since we know the problem often comes from necessary pills, our strategy in this 30-minute guide is twofold. First, we will show you how to safely investigate whether your dry mouth is linked to the medications you rely on. Second, we will give you powerful, science-backed solutions to stimulate the flow and protect your mouth while you are taking them. It is absolutely vital that we begin with a strong, clear disclaimer. We are producers and educators, not doctors. Never, ever stop or change your medication dosage or schedule based on advice from a YouTube video. You must always consult your prescribing physician or your pharmacist first. This video is designed to empower you with the right knowledge and the right questions to ask them. Right now, if you are experiencing dryness, grab a notebook. You need to keep a simple symptom log. Write down all the medications and supplements you take, and note the times you feel the dry mouth is at its worst. Is it an hour after your morning dose? Is it just when you wake up? Having this simple record will turn you into an informed advocate when you talk to your healthcare provider. This log is the first critical step toward lasting relief. We are going to walk through 5 of the most common medication categories associated with dry mouth. These categories are essential because they cover so many of the health concerns common to the Silver Smile and Bites audience. Knowing these 5 groups will help you start narrowing down the potential cause. We will begin with the big one, antihistamines and decongestants. These drugs are the most famous for their drying effects, but most people don't realize just how they work, or that relief is possible. Let's start there now, and learn how to manage the sniffles without creating a desert in your mouth. If this kind of clear, actionable advice helps you feel better and live with more vitality, consider tapping the like button and subscribing. We deliver practical solutions like this every single week. Antihistamines and decongestants are designed to dry up the mucous membranes in your nose and sinuses. This is great for allergy relief, but they are not selective. They dry out your mucous membranes, including the ones inside your mouth. This effect can last hours after the dose. If you rely on these, consider switching from a 24-hour pill to a shorter-acting version you can take only when symptoms are severe. Even better, Discuss non-drying alternatives with your pharmacist, such as saline nasal sprays which hydrate rather than dehydrate. The takeaway here is to target your relief. The second huge category is blood pressure and cardiac medications. Many common drugs for hypertension, like some diuretics or beta blockers, are linked to reduced saliva flow. Since these medications are non-negotiable for heart health, we cannot suggest altering them. Instead, this is where Pillar 2 of our overall strategy, saliva stimulation, becomes crucial. If your medication blocks natural production, we have to artificially encourage it. This means keeping sugar-free gum or mints on hand that contains xylitol, which not only stimulates the flow, but also fights the cavity risk posed by dryness. Next, consider the widely used class of drugs, antidepressants and anti-anxiety medications. These work on complex chemical systems in the brain that also regulate many involuntary functions, including salivation. Dry mouth is one of the most frequently reported side effects. If you're on these long-term, you must communicate the dryness severity to your doctor. Sometimes, a simple shift in timing, taking the dose right before bed, for instance, can push the peak drying time to when you're asleep. This is a simple fix, but it requires that open communication with your physician. Our fourth major group is pain medications. Certain types of strong pain relievers, particularly opioids, and even some muscle relaxants, can have a strong drying effect. Chronic pain management often requires these, so the solution is focused on meticulous oral care. With diminished saliva, your risk for gum disease and cavities increases dramatically. You must use a moisturizing, alcohol-free mouthwash and an extra gentle, non-foaming toothpaste, as the common foaming agent, SLS, can actually be irritating to a dry mouth. Check the labels for products formulated specifically for dry mouth relief. Finally, we have common drugs for urinary incontinence and Parkinson's disease. These medications often work by blocking specific neurotransmitters that control muscle spasms and involuntary actions. Unfortunately, those very same neurotransmitters are essential for stimulating saliva glands. If you are using one of these and experiencing severe dryness, you have uncovered a strong clue. Your next step must be scheduling an appointment to explore therapeutic substitutes or strategies with your specialist. Do not assume your dry mouth is normal. So, you've investigated your medication list. You've identified a likely culprit. Now what? You can't just stop taking your prescriptions. This is the moment to become your own healthcare advocate. This knowledge empowers you to ask for solutions, not just accept the symptoms. We are going to provide you with the exact phrases to use when speaking to your prescribing doctor or, even better, your pharmacist. Your pharmacist is an underutilized resource. They are medication experts who understand side effects and drug interactions better than almost anyone. They can often spot an alternative solution quickly. Here's the simple script. Start with a neutral, factual statement. Say, I've been experiencing significant dry mouth, and I noticed that my name of medication, e.g., blood pressure pill, lists xerostomia as a common side effect. Because this is impacting my ability to eat and sleep, I need a safe alternative. Could we explore options? Or is there a different dosage schedule that might help? Notice how that script is collaborative and focused on function. You're not demanding a fix. You're asking for a partnership. You're also stating the impact, eating and sleeping, which makes the symptom a priority. In many cases, the doctor can swap you to an equivalent medication within the same class that uses a slightly different chemical mechanism, potentially eliminating the dry mouth. Or they might suggest taking the full dose at night to minimize daytime discomfort. Make the commitment now. Schedule that conversation this week. It is the only long-term fix for medication-induced dryness. But what do you do in the meantime? While you wait for that appointment, your comfort is paramount and your oral health is at risk. We now move into the crucial, practical steps that form the third pillar of relief: protection and immediate stimulation. We need to create a protective environment in your mouth that mimics saliva's natural functions. This is essential, especially for adults over 55. One of the biggest risks of chronic dry mouth is the erosion of your tooth enamel. Saliva naturally neutralizes acids and washes away food particles. Without it, bacteria thrive. The best immediate defense is an intentional shift in your daily hydration and eating habits. It's not just about drinking water. It's about how you drink it and what you pair it with. Let's delve into the simple, immediate adjustments you can make right now to protect your smile. When we talk about hydration for dry mouth, we must abandon the myth of chugging a huge glass of water. That water moves through your system too quickly to provide lasting relief to your mouth. The secret is the sip, don't gulp method. Keep a water bottle with a straw nearby at all times. Taking tiny sips, perhaps every 5 to 10 minutes, keeps the oral environment consistently moist without flushing your system unnecessarily. This constant low-level rinse is far more effective than 3 large gulps an hour. Next, look at the temperature of your drinks. Avoid very cold or very hot liquids, as extreme temperatures can sometimes irritate already sensitive, dry tissues. Room temperature or slightly cool water and warm herbal teas, like chamomile, are often gentler and more soothing. And critically, you must avoid all carbonated soft drinks, sugary fruit juices, and especially energy drinks. The combination of high acidity and sugar in these drinks is a catastrophic recipe for tooth decay when you have low saliva. Remember, every sip of those drinks is accelerating damage. Stick to plain water or non-acidic drinks like milk, which can help coat and soothe the mouth. Our nutrition choices also play a huge role in lubrication and protection. If you suffer from dryness, you must deliberately choose foods that contain high natural moisture. Think about the contrast between eating a handful of dry crackers and eating a juicy slice of watermelon. The crackers require effort to swallow and absorb moisture, while the watermelon contributes moisture. Focus your meals around soups, stews, yogurt, cottage cheese, and soft fruits like bananas and pears. At mealtimes, take small bites and chew thoroughly. The act of chewing, even without food, is a powerful mechanical stimulus for saliva production. But chewing fiber-rich, moist foods is even better. Make it a habit to add sauces, broths, or gravies to your food. This helps the food move smoothly through your mouth and down your throat, easing the discomfort of swallowing. Avoid dry, crumbly, or sticky foods that will adhere to your palate and gums, creating immediate discomfort and potential irritation. Now let's talk about the nighttime protocol, which is arguably the most critical period for dry mouth management. Why is night the worst? Several reasons. First, saliva flow naturally decreases significantly while you sleep. Second, many people, especially as they age, become mouth breathers, particularly if they have issues with snoring, congestion, or sleep apnea. Breathing through the mouth for 8 hours completely evaporates any lingering moisture. To combat this nighttime dryness, your bedroom environment needs to be optimized. The simplest and most effective tool is a cool mist humidifier placed close to your bed. This adds moisture to the air you breathe, which helps reduce the evaporation from your mouth and nasal passages. Clean your humidifier regularly to prevent mold buildup, and run it on a low setting throughout the night. This is a gentle, passive way to protect your mouth while you rest. Beyond the humidifier, we need to focus on oral barrier protection. Before bed, after brushing with a non-SLS toothpaste, use a small amount of a specialized overnight dry mouth gel. These gels are thicker than sprays and are designed to coat the tissues of your mouth and throat, forming a slow-releasing moisture barrier that lasts longer than water or standard mouthwash. Products containing glycerin or specific oral enzymes work well. Apply it directly to your tongue, gums, and the roof of your mouth. This simple step can make the difference between waking up painfully dry or comfortably moist. And finally, consider a small, gentle strategy before you drift off. Keep a tiny piece of ice chip in your mouth. Let it melt slowly. This provides a gradual, sustained release of moisture and can help stimulate a minimal amount of saliva just as you are drifting off to sleep. Remember, consistency is everything here. By establishing this clear nighttime ritual, humidifier, gel, and gentle sipping, you are proactively protecting your oral health during the most vulnerable hours. We've talked about the causes and immediate fixes. Next, we'll move on to a proactive strategy to boost your saliva naturally throughout the day, ensuring you have relief that isn't dependent on a gel or a sip of water. The goal now is to maximize the work of the salivary glands you still have, especially if medication is suppressing their function. This is pure, evidence-based stimulation, focusing on mechanical and gustatory activation, meaning using movement and taste. Chewing is one of the easiest ways to prompt saliva flow. Your body associates chewing with incoming food, so it automatically increases production. Since we don't want to chew actual food all day, sugar-free chewing gum is the gold standard. Look specifically for gum sweetened with xylitol. This is a powerful, science-backed product that does 3 things simultaneously. It stimulates saliva flow. The chewing action itself encourages flow. And xylitol actively inhibits the growth of bacteria that cause cavities. If you have chronic dryness, xylitol is a non-negotiable part of your daily toolkit. If you don't like chewing gum, sugar-free lozenges or hard candies also work by encouraging the mouth movement and sustained sucking action. Again, they must be sugar-free, ideally containing xylitol or sorbitol. The slow dissolution of the candy mimics the sustained action of saliva and helps keep the mouth moist. Remember to avoid sour or citrus-flavored candies unless directed by your doctor. While extremely sour tastes are the strongest stimulants, they are also highly acidic, which can erode your weakened enamel very quickly. For protection, stick to mint or mild fruit flavors. Beyond products, you can use simple physical therapy. There are small, gentle exercises you can perform throughout the day to encourage the major salivary glands. Try this simple technique. Using clean hands, gently massage the glands located just in front of your ears and then beneath your jawline. Apply light pressure and massage in small circular motions for about 30 seconds. Do this when you are sitting and watching television or reading. This manual stimulation can often trigger a momentary rush of saliva, giving you temporary, natural relief. Another powerful stimulation technique involves your tongue and palate. Press your tongue firmly against the roof of your mouth and hold it there for 5 seconds. Then release. Repeat this 10 times. This action stimulates the major parotid glands. These exercises are completely discreet and can be done anywhere. By integrating these simple habits, chewing xylitol gum after meals, performing gentle massage, and doing palate presses, you are actively participating in your own treatment, not just reacting to discomfort. Now, we need to address the broader context. While medications are the #1 hidden cause for our age group, it is irresponsible not to mention other serious underlying health conditions that dry mouth can signal. It's crucial to recognize dry mouth as a symptom, not a diagnosis, and to look deeper, especially if your dry mouth is severe and recent. Two major health conditions are commonly associated with chronic dryness. First is diabetes. Uncontrolled blood sugar levels often lead to dehydration and changes in saliva composition, making the mouth feel persistently dry. If you have been experiencing thirst and frequent urination, along with the dryness, you need to check your blood sugar levels. Early diagnosis of diabetes is essential for preventing serious long-term complications. Second, an autoimmune disease called Sjogren's syndrome is often identified through severe, persistent dry eyes and dry mouth. This condition causes the immune system to attack the glands that produce tears and saliva. Sjogren's affects women more often than men, particularly after age 50. If your dryness is accompanied by burning or a feeling of grit in your eyes, this warrants an immediate discussion with your primary care physician or rheumatologist. Recognizing these links transforms dry mouth from a mere nuisance into a key indicator of systemic health. We've now covered the biggest hidden cause, medication. We've given you the script to talk to your doctor, and we've provided immediate relief and stimulation tactics. But we must also consider common lifestyle factors that might be silently exacerbating the issue for adults 55 and over. These are the small things we overlook because they feel harmless. One critical lifestyle factor is the daily habit of caffeine and alcohol consumption. Both are diuretics, meaning they cause your body to excrete more fluid. If you start your day with 2 large cups of coffee and wind down with a glass of wine, you are actively working against your hydration efforts. Caffeine and alcohol consumption leads to generalized dehydration, which directly impacts saliva production. If you can't eliminate them, the strategy is simple: counterbalance. For every serving of coffee, tea, or alcohol, you must drink an equivalent or greater amount of plain water. Think of it as a hydration debt you immediately pay off. Another major lifestyle consideration is smoking and tobacco use. Nicotine and the chemicals in tobacco smoke dramatically reduce saliva flow and irritate the delicate tissues of the mouth. If you are a smoker, this is often the single most destructive habit contributing to your dry mouth and the resulting dental decay. There is no gentle way around this. Quitting tobacco is the most effective intervention you can make for your oral health and overall vitality. We also need to address the impact of stress and anxiety. When you are stressed, your body activates the fight-or-flight response, which redirects bodily resources away from functions like digestion and salivation. This is why you often feel a cotton mouth before a big speech or a difficult conversation. Chronic low-level stress can lead to chronically suppressed saliva flow. While it sounds simple, incorporating mindful breathing techniques, even for just 5 minutes a day, can help switch your nervous system back to rest and digest, restoring normal bodily functions. Find a quiet corner, close your eyes, and take slow, deep belly breaths. This small mental shift can have a measurable physical impact. Now let's tie everything back to the core promise of this video: finding a permanent solution. The permanent solution involves successfully addressing the root cause, which we revealed is often medication. You have the log of your symptoms and the specific script to discuss the medication swap with your doctor or pharmacist. This conversation is the linchpin. If they can safely adjust your prescription, you are likely to find that your dry mouth resolves entirely. That is the true fix. If, however, your doctor determines that the medication cannot be changed, perhaps it's the only drug that controls a critical condition, then your focus must shift entirely to expert management. In this scenario, dry mouth becomes a chronic condition you must actively manage every single day. This is where the pillars of stimulation and protection become your lifeline. You must view the xylitol gum, the nighttime gel, and the humidifier as essential medical tools, just as important as the medication itself. Consistent, meticulous effort is the maintenance plan for your long-term health. The key to succeeding with this ongoing management plan is accessibility. Make relief easy. Place your dry mouth sprays, lozenges, and water bottle at every location where you spend time: your bedside table, your desk, your car, and your pocket. If relief is immediately available, you will use it more often, and you will suffer less. Before we conclude, let's look at one final, simple tip for immediate daily relief that many people overlook: carrying a small bottle of saliva substitute spray. These products use ingredients like carboxymethylcellulose to mimic the viscosity and moistening properties of real saliva. A quick spritz provides instant relief and lubrication, making it easier to speak and swallow in moments of severe dryness. This is the ultimate pocket tool for managing your symptoms on the go. You now have a complete, evidence-based roadmap. You know the #1 hidden cause. You know how to talk to your doctor. And you know the 3 pillars of action: hydrate smartly, stimulate constantly, and protect aggressively. This comprehensive approach is how you move from merely coping with dry mouth to actually controlling it and protecting your long-term health. Remember the vital importance of this work. It's not just about comfort, it's about protecting your teeth, improving your nutritional intake, and ensuring your overall vitality as you age. Dry mouth can erode enamel quickly, leading to costly and painful dental work down the road. Treating this symptom is a proactive investment in your future self. If you found this deep dive into the hidden cause and the specific solutions helpful, please show us by tapping the like button. Your engagement tells us that this kind of detailed, science-backed health information is what you value most. And if you want to keep improving your vitality with simple, clear steps, make sure you subscribe to Silver Smile and Bites right now. Don't miss our upcoming guides on gentle movement and mindset shifts that complete the picture of healthy aging. We started this journey by talking about the frustration of feeling like you're doing everything right but getting no results. The truth is, chronic dry mouth is rarely a simple hydration problem. It's almost always a systemic issue that requires investigation. You have taken the first most important step by educating yourself about the role of medications and underlying conditions. Your action plan starts today. Review your symptom log and your medication list. Schedule that conversation with your pharmacist or doctor. Commit to implementing at least 2 of the protection tactics, the xylitol gum and the nighttime gel, starting tonight. You have the knowledge and the tools to turn this around. Don't let dry mouth diminish your quality of life or damage your smile. Take charge of your health, ask the hard questions, and trust in the practical step-by-step solutions we've laid out for you. You deserve to speak, eat, and sleep comfortably. Start that journey to relief right now.